Next on the agenda is Juan. Juan is a labor organizer from Revere who currently represents frontline workers at SEIU 32BJ, woohoo for comrades on the front lines, and is a candidate for state rep in the 19th Suffolk district, which is being vacated by Bob DeLeo. And Juan Jaramillo will be talking to us about what Medicare for All would mean for folks in Revere and Winthrop, where he lives and is running.
Thank you so much, Stephanie, for having me here today. And I'm so excited to be here amongst all of you, community, family, who have been putting your bit to ensure that we have healthcare for every single person in the Commonwealth and in the country that is debt-free and not tied to work. I grew up right here in Revere. I was a frontline worker that worked in the ICU at Mass General Hospital during the Boston Marathon bombing. I know exactly what frontline workers are going through today. They're afraid for their lives. They're afraid of not going to work because they can't afford to lose their health care. So this issue is just so personal, right? We have to make sure that communities like Revere that have been disproportionately affected, that are disproportionately affected by this pandemic because of the air pollution and the high asthma and COPD rates, have the healthcare they need. That in the time that we're seeing virus rates in Revere that are some of the highs in the Commonwealth during a pandemic, they're losing their jobs and their healthcare is just inhumane. We cannot continue to do that. And further, we can't go back to the supposed normal. We can't go back to a time when frontline workers or any worker or even any person can't afford to lose their job because of their idea of their healthcare. As a labor leader, I sit across the way against management who leverages healthcare to continue to oppress workers in the workplace. It's one of the most expensive items every time we go to negotiate a contract. And what that means is that if they can hang healthcare over the worker's head, they can lower their raises, lower their standards of work, lower their benefits. And we cannot continue to hold up that status quo as we get out of this pandemic. The new normal cannot be even remotely close to what we had before for the people of communities like Revere, largely immigrant communities. So I'm really honored to be here today. I really appreciate it because this community, deserves healthcare for all that is not tied to work, that is debt-free. And when I say all, I mean every single part of every community in the Commonwealth. This is a largely immigrant community, a working class community that deserves this, that has stuck their neck out for us, from cleaning our beds to providing for our food system. Thank you.